ER overcrowding. Can urgent care centers help? This presentation is brought to you by myself, Christopher Turner. Lesson plan. So to discuss ER overcrowding, it's important to cover a few sentiments, some key factors, such as the causes, the effects, the role in which urgent care centers play, the similarities and differences between ERs or emergency departments or emergency rooms and urgent care centers, some stumbling blocks to urgent care centers, some disadvantages, things that can be considered drawbacks, and the conclusion or finale. ER overcrowding causes. So the biggest and perhaps the most intractable cause of ER overcrowding is primary care. So primary care essentially works as a gatekeeping for patients to see specialists. Primary care providers have the advantage of a more comprehensive care plan for the patient. In order to fully grasp a medical concern, a primary care has the advantage of history, continuity, and again, they can refer patients to different specialists to address patient needs. Another cause is the lack of pertinent UCCs. Now, the operative word here is pertinent. Pertinent because it, there are only 20% of UCCs in urban areas. Unfortunately, um, the people that need UCCs the most are people that are in highly concentrated areas, highly dense areas. And so that's where the main focus or the main address should be in regard to constructing UCCs. And the last one, patient education. Now, this one works twofold because a lot of patients don't even know about alternatives to emergency rooms. So there needs to be a better marketing campaign to get the message out. And the other fold is that a lot of people don't know what constitutes an emergency. Um, if there a lot of um, areas have nursing hotlines, so if there are any concerns, a patient can call a nursing hotline, and that nursing hotline can point that patient in the right direction, whether or not they need to see an emergency room or not. ER overcrowding effects. So one effect is long patient wait times, and long patient wait times can erode the trust of a lot of patients. You want patients to seek care, especially if there is a problem. You want patients to see a medical professional, and if there are long patient wait times, then a patient may be discouraged from seeking the medical attention that they need. Another um, detriment to long patient wait times is the potential of missing critical injuries. Um, ERs, they try their best to triage or sort patients, but if there are just too many people for the staff to see, then they do run the risk of missing a life threatening illness. Another key factor or another detriment of ER overcrowding is a depletion of supplies. This could be quite costly for a lot of ER departments. And the third is staff burnout. Staff burnout can lead to ruined morale, and it also can lead to fatigue, which can cause costly and life threatening mistakes for nurses and other clinicians and healthcare professionals. The role of UCC. So the role of urgent care centers is to basically treat non-emergent patients. Now, an example of a non-emergent patient is a person who has a a stomach ache. However, they are able to retain water, or they're able to hold down water. The trick or the problem with this is that pain is relative, and different people have different tolerance level, have different tolerance of pains. So it's hard to pinpoint exactly how much pain a patient is in. UCCs, they're a healthy alternative for patients seeking medical attention. This is because UCCs, they do have trained professionals, and the UCCs themselves have some diagnostic tools at their disposal. Pretty simple but still effective, like X-rays and labs. Also, the UCCs, they help the healthcare industry and all stakeholders involved. According to the Journal of Medicine, UCCs could save the country $18 billion if the appropriate people went to a UCC. Now, I get it. This is more idealistic, but it does give an interesting indicator on how effective UCCs can be. And another role that they're playing in today's healthcare landscape is they're becoming more prevalent. And as time progressed, there are more UCCs being built. So there are primary differences and similarities between emergency rooms and UCCs. Treating what's most the what's most important about an ER is that they're able to treat um, emergencies. So these are things such as uncontrollable hemorrhaging or things that can compromise breathing. Uh, Injuries that within minutes can fully debilitate you or cost you your life. Also, ER, they're equipped with a wide array of diagnostic tools. They have a lot of tools at their disposal, such as CAT scan. Some ERs even have MRI machines. Um, Another, unfortunately, detriment to ERs is they're significantly more expensive. A tab at the ER can easily run up into the thousands. And like I mentioned before, and the whole point of this presentation is really long patient wait times for ERs. However, UCCs, they are better equipped to treat minor to moderate illnesses, such as controlled bleeding with small blood loss. UCCs, even though they typically lack comprehensive diagnostic machines like CT, again they do typically have basic X-ray and some labs. They are less expensive instead of your bill running up into the thousands. Generally speaking, a typical UCC tab will run up in the hundreds, and they have shorter wait times instead of spending hours and hours in a UCC. Um, Again, typically you can be seen under an hour within minutes, although there are exceptions. UCC stumbling blocks. Um, One of the biggest drawbacks to urgent care centers is the demographic of people that they see. So unfortunately the people that tend to be affected by injury or illness the most are elderly, and only 10% of people who are 60 and over actually utilize UCC. So again, there has to be a stronger marketing campaign to reach out to older people. This can come in the form of PSAs, literature, but there has to be a message that resonates so that older people can utilize UCC. Uh, big Another big drawback with UCCs are the trade-off between accessibility and quality care. So there's three pillars to healthcare. One is accessibility, the other one is affordability, and the last one is quality care. UCCs, they do offer another alternative for people to seek medical attention. However, they do lack that continuity that's so important in healthcare. That's where primary care tends to come in. So it's important to maintain a balance between all three pillars. Conclusion. Overall, UCCs are a net positive. They have the ability to save the healthcare industry, which means payers, which means healthcare organizations, and most importantly, patients, um, billions of dollars. Um, was important is that there needs to be a robust healthcare plan for the future. So as time progresses and as AI starts to enter the fold, it's important that um, we de- we develop mechanisms that ensure or maximize that the most vulnerable aren't left behind. This means elderly people, um, people that are critically ill, and people that live in rural areas. These are the references. Thank you for your time.